I'm gonna sit next to you for just a second.
Okay.
Let's test that little microphone. How does that look? Oh, it looks crooked, doesn't it?
I don't know. A little bit up this way, maybe. Don't you think?
Yeah, it needs to go like this a little bit. Hi!
Test.
Welcome to the show!
It's cold.
Welcome to Super Soul Sunday. Once again, I'm Oprah. Let me see if... So we're gonna start.
Do you want me to test the mic? Did we test it?
We did test it, and
it worked?
Yeah, it
Okay.
did. And we are good to go. You ready?
Okay, yeah.
Oh, I want to be able to see us.
Oh, you like to see yourself?
It just makes me...
Yeah. Okay.
Ladies and gentlemen, welcome to the Dr. Burchett Show. Scratch. We're going to do that again. Ladies and gentlemen, welcome to the Dr. Burchett Show. I am joined today by OBGYN Dr. Pari, Godsey. Thank you for coming.
Thanks for having me.
We're going to start with a question from my Instagram. This is a good one, and it's going to lead into a topic where our OBGYN is going to give us a lot of expertise exploring the female anatomy, orgasms. And this is directed, a lot of this is for men, to help men, but I think also for women to explore their own sexuality and bodies as well. Okay, the question comes from W. Levine, and the question is, she's a therapist, and she wanted to know, anatomically speaking, with the female body, she gets a lot of clients, and she's mainly talking heterosexual, male-female, that come in having bad sex lives. And that's part of their therapy and what they talk about. And her question for us, for you, is, anatomically speaking, are there bad things? Like what would you say or contribute to that topic?
I think that's a really good question, and I think probably as a therapist, she's dealing a lot with the emotional stuff and the communication, which is such a huge part of sex and sexuality, so I definitely don't want to dismiss that. Anatomically, I don't know if there's a lot of things that people are doing wrong necessarily. It's more of just trying to get an understanding about your anatomy. A lot of people don't understand their anatomy, women alone. They haven't taken the time to sit down, look at their anatomy, understand what's going on there.
Look at their anatomy.
Yes, look at their anatomy. And
I will admit, I've looked at my anatomy.
Well, I'm sure guys are a lot more comfortable, I think.
Do you think?
I think so, even starting at an early age.
Or like obsessed almost?
Well, yeah, that could be probably accurate. You know?
So let's jump into, I want to jump into a couple questions. You even said this question before, what is the vagina?
Yeah.
That's like a funny question.
I mean, I think because the reason why I mentioned what is the vagina is because it goes to the anatomy, and that the vagina is actually just the canal where the penis goes in and the baby comes out, but people think the whole thing's the vagina. And I'm just trying to get technical.
What do you mean the whole thing?
So basically...
You mean the whole collective female genitalia?
The whole collective female genitalia people refer to as the vagina.
Okay.
So I'm saying if you want to really understand your anatomy and you want to get technical with all of the different parts, the vagina is just specifically the canal.
Okay.
Okay. Outside of the canal...
And there's some other parts in addition to the canal.
Yes, and I'm gonna go over those.
As we've learned.
We're gonna go. So outside of that, the area that you kind of see if you were looking directly at a female would be what we describe in total as the vulva. Okay, and then that
this is what it looks like from the outside.
From the outside, if you're looking directly at someone, again, you can't see inside. The inside's the vagina. So the part that you're seeing, you know, straight on, is going to be the vulva. Okay. The vulva is comprised of two different sets of lips, essentially. Right? There's outer lips and inner lips. The technical term is
labia.
Yes. Yes. So you did go to medical school, so I don't know.
I am a doctor.
I don't know why you get so much credit for that, but okay.
I'm not just Oprah today on Super Soul Sunday.
So the outer lips are what we call the labia majora, the inner lips are the labia minora, and if you follow the labia minora up to where they meet, that's the clitoral hood, and under that is the clitoris or clitoris, which is the main star of the show.
I was going to say the main.
Star.
Let's get that dance going. I didn't mean to interrupt that.
Main star of the show.
I want to hear more about
Okay.
the main star of the show. Oh shoot! That distracted me. There was
Sorry.
something else that I was going to. Oh, as you were talking about
Yeah.
labia, something we're going to talk about later is labiaplasty, like a new plastic surgery thing where you have them removed.
It's what's considered, some people are calling it like a designer vagina. It's cosmetic surgery specifically for the inner lips or the labia minora. And I think this is a really important topic. I don't know if you want to get into it now.
Let's push pause
Okay.
on that
Okay,
as a
sure.
relevant one. So keep taking me through the female anatomy.
Okay.
And for men and women, so what? So what's the good thing about getting to know that? And this is the other thing, is you were what did you say? All roads. Maybe I heard all roads lead to the clitoris. And I was just thinking, like, I think some men, maybe women, are like, how do I find it?
Right. Well, and that's a good way of finding it, is knowing if you are touching or looking or feeling where your inner lips are, and if you follow it up, it kind of meets at the top, just like this, and then that's the hood, and then right under there would be where the clitoris is. And when you ask, well, why does this matter?
Yeah.
It matters because the clitoris is the main kind of pleasure spot for a woman. It's the easiest way for her to achieve an orgasm, and so if she's able to get familiar with that, even by herself, then she can also help her partner. Men, if you want to ask, I think communication is great. If you're a little bit confused, there's nothing wrong with that. And then you guys can figure that out, and therefore you can have, easier, better orgasms with your partner.
Maybe a good way to ask if you're a guy is, hey, show me how you like to be touched. Mm-hmm. How can I do that? Teach me.
Right.
I think I've heard some say that that's kind of a turn on.
Yeah, of course.
For in a lot of ways,
Right.
not just like that they're interested in learning, but that you have the honesty and
Right.
the communication in the relationship to,
Yes. Well,
to kind of go there.
And the thing is, and that kind of brings up another point, is that female sexuality and female orgasm and excitement and lubrication and all of the things that come together are so closely tied for a woman with emotional connection, safety, feeling like they're tied to the person that they're with. It's not the same for a man. So
I'm listening to every
Yes.
word. You're going really fast.
Sorry.
I heard like sexual excitement and lubrication and then security. But I understand what you're saying.
Mm-hmm.
It's more than just penis, vagina, intercourse. There's more to it.
Yeah.
Tell me more about that. We're kind of getting into orgasm and pleasure. Are there other things anatomically we should point out first, or can we talk about orgasm?
Well, no, we can also go to a very important question, which is the other way that a lot of women, or not a lot, some women talk about how they can achieve orgasm, which is the G-spot, which is a very common question and elusive question.
This is such a great question, okay? I was excited to ask, and you and I may have a different opinion on this medically. What is the G-spot, and is it a real thing? Is it a unicorn? Unicorns aren't real. Is it like a unicorn? Is it real?
Is it real?
That's the question for you, doctor.
Yeah, well, medically speaking, even as a gynecologist, the jury is out. And when I say the jury's out, it's really not that can women achieve orgasm internally or from this area alone. It's more of, is this like a separate anatomical thing? And so Is it a separate anatomical thing from what? Sorry, I should have been more clear. Is it a separate anatomical entity in general? Is it something
as opposed
that you can,
to like an extension of
something else,
clitoris,
right.
like you had said before.
Right.
Okay.
So what I believe is that actually, if it is a thing, well, and let me kind of describe where it is first of all.
Okay.
So, and where you can find it if you are a man.
Where
and
you can find it.
Yeah, if you're a man and you're
good.
if you're wanting to try to find it.
Not that I don't know where it is, but I'll listen up just in case.
We'll give you another clap for that.
Give me a little refresher.
So where it is it's 1/3 inside of the vagina, which now you know what the vagina is. It's the canal. It's 1/3 inside of the way of the vagina, and it's on the anterior, which is a medical word for top, basically wall of
front,
the
top,
or front,
yeah,
top,
okay.
exactly. And it's a kind of pea size, maybe a little bit larger area of tissue.
Okay.
And when it's stimulated, women can possibly achieve orgasm.
Oh, so how can we do that?
So
what would be? You don't just want to rush in there and do that.
No. Well, let me go back to also what I was saying is it its own thing or is it part of something else? And the part of something else that we had talked about was is it as an extension of the clitoris? And there is a belief that, well, we know the clitoris is not just kind of that little, bean or whatever you want to call it that you see or feel from the outside, but that it actually has legs to it is a way to describe it.
I've never heard this before, so tell me more about that.
So we think it's, again, maybe about 4 centimeters, 5 centimeters of extension of legs that are kind of
so you've
going
got kind of the hood.
Yes.
And then the clitoris is under there.
Yes, and it's more of like an extension, like a nerve bundle that's kind of veering off and in.
Yeah.
So the idea of the G-spot would be, okay, that's an extension of this nerve bundle of the clitoris. So when it's coming down and hitting, that's where it kind of meets.
You get the clitoris, you got its legs, and then they come back together at this
juncture or whatnot.
this tissue or whatever it is.
Exactly.
Okay, so we know what it is, and you said the jury's out, but where do you stand on this?
I believe that it's if it is a thing, that it is just an extension of the clitoris, that it's not a separate.
If it is a thing, I'm going to push you. Is it a thing?
Yeah.
Is it a thing?
I'm not totally convinced that it's a thing and it's not just a way of, I don't know.
You're not convinced.
I'm not
but you're
totally convinced.
You're not like G-spot atheist.
No, not at all. More like a agnostic.
Yeah. I'm a believer. I think it's a thing.
Yeah.
I'm not saying it's distinct from the clitoris. I think all of those nerves, there's probably so many interconnections and bundles between all of it.
I would believe that. It's just more of when people discuss it as a separate body part that then I'm like, no, I don't really know about that.
I think I like it, especially in the context of this conversation, as another place you can focus on for sexual pleasure. And it's an important spot. If you just think, oh, clitoris, that's it, and you forget about it, then so I'm a believer. That's why.
But I think it is also important to note that it's also a more difficult spot for a woman to achieve an orgasm, and so I don't want men to be hyper focused on it and then feel disappointed if the woman can't achieve an orgasm.
So tell me a better kind of context to put G-spot stimulation or involvement in.
I think it's definitely something that you should explore and see if your partner can achieve orgasm from it, but I definitely think it's something that takes more exploration, and like you were saying earlier, it's not something you want to just like attack, and I don't think it's something you want to depend on either. But the best way that people we tell people to kind of see or explore and see how they feel with it is to just manually at first try to insert fingers and then reach where we were discussing it would be located, and then do more of like a come hither motion is what we say, like this, like a and see if you can stimulate something in that way.
I think that's great. I think that's great advice. So there you go. There's anatomy, and let's talk a little more about orgasm. This is another great question. I really appreciate having you here for these questions, because there's a lot of them that I've thought a lot before, and I can't tell you the last time that I asked a GYN some of these questions. So along the G-spot clitoris conversation, are there different orgasms for clitoral orgasm or G-spot orgasm? I feel like I've heard that before. I feel like I've heard women say clitoral orgasms are easier for them to achieve. They can use, kind of their fingers and make that happen. It's more difficult to achieve a G-spot orgasm, but those are like
more intense.
Yeah, they're more intense.
Yeah.
Is that like a thing?
Most women do describe when they have a G-spot orgasm to be much more intense. Okay, and I'm gonna to say something and tell me what you think.
Okay.
Okay, so when you were just saying the difference of, is it a G-spot internal or the outside, just like, external stimulation, that those are the difference. Well, think about this. Let's say you're having intercourse and you're having penetration via penis, and that orgasm is much more intense for a woman than, say, just external stimulation alone from the outside.
Okay.
Now, the question I'm going to pose is that a G-spot orgasm, or is that still a clitoral orgasm with now something inside of her vagina? And does that make it much more intense? Do you see what I'm saying?
Yeah, no, I see exactly what you. So that's like if a woman's just masturbating,
right?
Or
oral sex, even, or anything that's external
versus an internal
because
orgasm.
Right.
So I would say it depends, and I would ask the woman.
Exactly.
And women who have had different, degrees of orgasm can tell you.
Exactly.
They can tell you, oh, this is what it feels like for that one. Sometimes I can achieve this one, or some women are able to have it more often.
Right. And it's very important, I think, for men to understand that a woman, only about 30% of women can achieve an orgasm from just strictly penetration. Most women need some sort of clitoral stimulation. Now, with that said, the clitoral stimulation could be from friction of intercourse, but it's just important to understand that a lot of women need external stimulation, whether that be oral, manual.
What percent of women, I don't want to say can't have an orgasm, but can't have an orgasm?
It's been quoted up to about 15% of women have not achieved an orgasm. Now,
ever?
Ever. Now,
wow.
What is interesting is that a lot of people, if you start to ask them questions, when I've had patients that come to me and they say, I haven't had an orgasm, or I'm not having an orgasm with my partner, when you start to talk to them about it, the most important thing that I think is, or the most interesting thing to me, is a lot of these people are in relationships.
Yeah.
They've been in a long-term relationship, and you ask them, does your partner know this? No.
Oh, wow. So they
fake, which is a whole nother topic of, you do not want to fake an orgasm because you're not getting anywhere.
Oh, that sounds like a doctor answer as opposed to we live in the real world. Sometimes you gotta fake it. I want to go to bed.
No, never fake an orgasm. Never fake an orgasm.
Oh, if
there's
principal, you are a principled doctor.
I mean, if there's one thing that I tell people, I'm never fake an orgasm, because I think it's also important to have an healthy understanding of intercourse and orgasms for women. And a lot of times women can't achieve an orgasm during intercourse, but that doesn't mean that the whole scenario was a failure.
Right.
It doesn't mean that she didn't experience pleasure from it.
Right.
It's not all about the orgasm. And so if you're consistently faking orgasms, then it's like this false pressure on it. And it's okay to say, hey, sometimes I didn't have one, and I'm going to be open-minded and, hey, let's figure out how I can have one. I'm not saying be happy or be satisfied with the fact that she didn't have one.
Yeah.
I want you to want to give her an orgasm.
Yeah.
With that said, if it doesn't happen, it's okay. Let's just try some different things later.
What would you say? I mean, what would you say to both a woman who's never had an orgasm or struggles to have it? I mean, I would imagine you would feel like, gosh, what's wrong with me? I can't have an orgasm.
Right. And some people
what would you say to that?
I think it's as a physician, when someone comes in with a complaint, you have to kind of break down what's going on.
Yeah.
And so it's the same thing when I have a woman come in that's like, I can't achieve an orgasm, you kind of start breaking down the problem. Is it recent? Have you ever had one? Do you understand your anatomy? Have you masturbated? And you kind of give them homework to kind of figure these things out, and you move from there.
Yeah.
I think it's a very, very small, much smaller than that 15%. I would say it's 1 to 2% that can never achieve one, right?
Yeah.
I think it's more about the fact that
1 to 2% you think never.
Yeah,
so
and
this
don't
15%,
totally quote me on that, because I would have to do the journal research, but it's small.
But it's
I know
better
it's
than
like
15.
1. I know
It's better
I
than
think
this
it's around 1
15%.
that actually are anorgasmic. 1%. It's 15% aren't experiencing because they haven't done the homework, done the work, figured things out.
So let's pretend like we've got somebody here who's never had one or infrequently has one. Give me 3 things for homework, like you said, that you would have them do.
The first thing I would do would be to have them do some sort of manual masturbation.
Okay.
Just feel by themselves.
Just play with
play
yourself.
with yourself and
Yeah.
try to, in a relaxed setting. A lot of times, and I'm going to add to that, in a relaxed setting, because a lot of this stuff, I know men experience this kind of stuff too sometimes around sex, is anxiety and anxiousness.
Yeah.
And then it's like, oh my gosh, I can't pressure, I can't achieve an orgasm. You get in your head, you're freaked out. So I think for a woman, I always say, you know, be alone. You know, masturbation is, and we kind of have that talk, and masturbation is healthy and it's helpful. And in a relaxed setting, light candles, make a romantic setting basically for yourself. I'm serious. And then start to explore your anatomy.
Let me get some candles on while I turn on the porn.
Or, you know, maybe some, well, not necessarily porn. That's a whole nother deal. But
we're not going to talk about porn
not going to do that
second.
But wait, okay, my 3 things. So then get in a relaxed, you know, have a glass of wine, like whatever you need to do to chill out. Whatever you need to do to chill.
This is like date night with yourself.
Yes, and that is healthy.
Okay. All right. So I'm learning something new here.
So have the date night with yourself. Do some manual exploration, kind of figure out what works for you, okay? I also recommend...
Play around and see what feels good.
What feels good. I also recommend trying also like some sort of toy or vibrator and see if that's helpful. And then third, if you have a partner, then that's great. Now we integrate the partner into those things.
So perfect segue. So how about what would you say to men who feel like their partners, their wives, girlfriends, whatever, don't have orgasms, and the man feels bad about that? Like, what's wrong with me? I'm not this like stud that can, you know, give my partner an orgasm. What 3 things would you tell the guy?
One is going back to that statistic that we mentioned, that only 30% of women will have one just with sex, intercourse, and that's okay. So that's like, okay, it's not you. Women are different. Women are more complicated than men in many ways, and this is one of the ways. And so, you know, kind of take that blame or pressure or whatnot off of yourself. And that would be step 1, understanding that it happens, and it's not normal, but it's above average if it's just an intercourse thing.
Pretty, just to kind of emphasize what you're saying. So it's pretty common. It's not your fault. There are things you can do to make it better.
Yes.
Such as.
And step 2, I would say, is be patient and be communicative.
Yeah.
And just do a feedback in the bedroom.
I would say moments like that, especially when you're talking about intimacy with somebody, not just a random sexual partner or not as close, but it's an opportunity to truly be intimate, you know, and to share. This is how I feel about this stuff. Here's my fears. I feel inadequate that I can't give you an orgasm, and I want to be a, you know, robust, sexual, virile man, you know. But a lot of times in my experience, just opening that is a way for you to come better and come closer, and the sex gets better,
because it's a bonding experience. And you know, there's a whole, you know, as you know, there's a whole difference between just sex and intimacy, and the stuff we're talking about is real intimacy. And a lot of times then that's a positive feedback back to, well, then that makes the sex better.
Yeah, that's so true.
Thanks.
I just want to say that. Like, I just want to get back to that thing.
Why don't you? What was the last? Yeah, I was gonna say, why don't you just do it?
I'm just gonna say what we just.
Yeah.
I'm just gonna say what we just talked about off camera, which was we kind of opened this talking about sexier things like the G-spot and, hey guys, here's how you can give her an orgasm, and it kind of comes full circle to this conclusion, which is, it's not about the orgasm. It's about the intimacy, the closeness, and kind of this cracking of the chest, exploring what's in you, like what you believe about sex, what you believe about yourself. Like, am I pretty enough? Am I fat enough? Am I manly enough? You know, am I a potent enough man, or whatever it is? And when we don't perform, which is very common, 30% of women need more than just a penis inserted for an orgasm. I think it's such an opportunity.
No, opposite. I'm going to correct you because I just want to get that.
What did I say?
You said 30%.
Can.
You said 30% need more, but it's only 30% don't need more. Like, only 30% can.
30% will have an orgasm with only that.
Yes.
Thank you for correcting me
Yeah.
on
So
that.
70% need more.
Most need more.
Most need more.
Where was I going with this?
I know, and I hated to interrupt you.
No, that was appropriate. I screwed up the statistic.
You were just saying, just opening yourself and
getting into.
Yeah.
On the one hand, I think men are sold an image of, conquistador sex and being this kind of a James Bond lover, whatever. One night stands, and it does us such a disservice because there's so much more greater growth and true strength and all these things that I think we really want to be, that you get into with real intimacy,
right?
And this real stuff. I don't want to talk too much because you're the guest. But let me say one more thing.
No, I want, yeah.
A buddy of mine who was nameless and got divorced, he was out, and this is what he said, he was out banging around. And he was telling me about it, and he was like, I hate condoms, and I go soft, and I don't really know these women, and he's trying to figure himself out in his sexuality after, and have fun, and like be single and be freed from an unhealthy relationship. And but his sex life wasn't any good. When he found the woman that eventually became his wife, his sex life was great. She was on birth control, which we're going to talk about in a minute. So he felt safe. He trusted her. He was more emotionally connected and available to her. So he didn't have to use a condom. And all of that, the sex was so much better. And I don't think that is uncommon, that without all of those elements, I think the image of masculinity, the part of masculinity that I'm kind of pushing back against, is that men should be able to have sex, to be able to fuck anytime, anywhere, with whatever. And in what I've seen in my ripe old age of 40 is that it's a lot more complicated to it. There's a lot more of that. God forbid men even have some emotions, that need to be present for the better sexual experiences.
Well, and when we were talking about it off camera, for me it was just really nice to hear, because I think as a woman, you know this about women, and as a gynecologist, as a single woman, you hear this from your friends that women, we need emotion, and there's this huge, I think, idea in society of, women need emotion, men don't. Men don't attach. Men aren't into intimacy.
That's what I'm talking about.
Yeah, that's what I'm saying. And so to hear you say that to me, I was like, oh, that's interesting.
Yeah,
that's nice to hear, because I've always heard the stereotypes that you're talking about.
Yeah, I mean, there's something to them, but I think most men who have experienced emotional, loving sex, it's better.
Where do you think that comes from? Like the image or the?
I think there still is a biologic, there is a sexual drive to sow your seed, to get out there, and you guys have one egg that if it gets, that's 10 months. We don't have that. So 100,000 years ago, our genes got passed on. The more we scattered them. So I think there is that. I think there's a societal misconception that reinforces that more. So there is a biologic and kind of a historical basis to it. But we've also evolved, to be emotional human beings and
not just barbarians
that have needs beyond just meeting our sexual urges and instincts, and so and that's like, it's synergistic. So you're meeting your sexual need and your emotional needs at the same time.
Right. Well, and I think that's a very nice way of looking at it, if a man can kind of wrap his mind around the idea of you're more evolved, really, if you can do both and meet both.
It's so true. It's so true. Yeah. Okay, where do we go from here? Oh, there's a lot of things that I could say about that. I'm going to tell you some of the other ones off camera, though. We're not giving everything right here. What else was on our list?
You want to do birth control
We
at some
talked about
point.
birth control for a little bit.
Yeah.
So let me lead off with this one.
Okay.
And as a doctor and as a man, I'm still shocked by the amount of unprotected sex that happens without desiring pregnancy. The number of people not on birth control. Personally, and feel free to chime in and slap me, correct me, but I'm not a fan of the birth control pill. There is so much caveat. There's some indications for things that I think it can help in GYN conditions and whatever, but for contraception, there's just too much user error. It's so easy to miss a couple pills and then it's not very effective.
Right.
In residency, I put IUDs in.
Right.
They're wonderful. Do you know what an IUD is?
I was going to say we should probably go over what an IUD is.
Do you know what an IUD is? Get one! If you're a woman of childbearing age, or talk to your doctor about it. Don't get one. It's not for everybody, but they're great.
Right.
They're pretty great.
Yeah, I do agree with you that, I like the birth control pill in general because as you mentioned, it can help with a lot of different gynecological problems for women. If you have heavy periods, if you have really bad, something that's called PMDD or premenstrual dysphoric disorder, if you have bad acne, it has a lot of non-contraceptive benefits.
Yeah.
And so I do think that if you suffer from those things in combination with needing contraception, it's a great alternative.
Yeah.
But I agree with you, it is the one that has the most user error of all of the options because it's a pill that you have to take every single day. I was actually just getting my hair done recently and I was talking to the girl and she was asking me, oh, what do you think about IUDs and what do you think about this? And she said, oh, I have a friend that, she takes the pill sometimes in the morning, sometimes in the night, sometimes she misses it. And she was like, and I'm like, no. She said,
why are you taking the pill? Like, that's worse than not taking the pill.
It's so funny because she goes, well, my friend, she says it doesn't really matter as long as I take it eventually. And I'm like, what? No.
How many pregnancies have we had with that pill?
Oh, a lot. And the thing is there's also a lot of misconceptions out there about the pill that I think lead to user error. One of them being, if you're on the pill for a very long time, then you can't get pregnant. So a lot of times people hear this misconception because it's a fertility concern. Because they're like, oh.
Is there any concern to that?
No.
You stop the pill and then it doesn't, you're not less likely.
No.
Okay. That's good.
If you stop the pill, for some women, it takes like a month or two to get a normal cycle back.
Yeah.
And that's it. But there's no long-term effects. But you can see how that misconception could then influence someone. I've been on it for 5 years.
Oh, I haven't gotten pregnant. I haven't been.
If I miss it a few times, it doesn't matter because when you are on it a long time, you can't get pregnant. Not true.
Oh, man.
There's a reason why you have to take a pill every day because that's when the hormones go out of your body and you've got to take another one, something that we call a half-life in medicine.
Yeah.
So if you miss one pill, I have seen people get pregnant. What we typically tell people...
Wait. Can we say that again?
Yes.
If you miss one pill out of 30 or 28 or whatever it is...
You can get pregnant.
So I want to emphasize this for the men watching this. If your partner, whatever, they're on the birth control pill and they miss one pill... you can get pregnant.
Yeah.
And that's a
most people, what we say is if you miss one, take another one, like take two at the same time, because this is something good to know. A lot of times partners
what happens
what
if
do
you
you do? Partners are freaking out. I missed my pill yesterday. Take it as soon as you remember it. So you would just take two at a time. But if you missed more than two, you need to basically that whole month.
You're fertile.
You are not covered. You have to use some sort of backup method. And really, if you miss a pill and you want to be extra safe, you really should consider taking emergency contraception.
Let me ask you something. So let me kind of switch this to a guy's perspective. What would you advise guys in this situation? Like, what's appropriate for us, for our opinion, in terms of what I feel like we can put a condom on or not? That's like in our lane.
Right.
What can we do at various levels in relationships, from being a husband to a boyfriend, in terms of communicating our feelings about her contraception. Just like this. Oh, I'm on the pill. It's great. Whatever. Yeah, sometimes I miss one. It's like, hey, I'm not comfortable with that.
Yeah.
Like, I have a problem with that.
I mean, I think exactly what you're saying. I think that's a great question because I think it's hard because there's also this other side of things where a woman's like, well, it's my body and it's my choice and I can take what I want to take and do what I want to do. But when it concerns pregnancy, that's a two-person deal. And sex is a two-person deal. So I do think it's a conversation that both people need to be participating in.
Yeah.
And I think even asking is the first step. There are people, like you said, that are banging around and they're not even asking, are you on anything? So
the real world out there is...
I think that's the main thing, is that you just have the conversation, start the conversation, and don't be afraid to voice your opinion. Now, you don't want to do it in a judgmental manner, of course, like, what the fuck is wrong with you?
So here's how it goes for me on the first date. Hey, how's it going? Like,
what do you use?
What do you do? Where are you from? Do you have an IUD? I'm sorry. It's inappropriate. We talk about this too. This was bad too. I have a daughter. She's 8. I'm like, when she hits 13, that IUD's going in.
And I was like, no, that's too early. That's too early.
But so what is an IUD?
Right. Sorry, we haven't done that.
Why am I pushing the IUD?
So an IUD is an intrauterine device. And so basically it's a very small kind of T-shaped, smaller than my finger. So this isn't even accurately portraying it. Exactly, but a T. And it is inserted into the cervix, which is the kind of what we call like the bottleneck or the mouth of the uterus. So the uterus is where a baby sits. The cervix is the part that opens up for the baby to come out. It's also the part where the sperm goes in to go find the egg to fertilize. So the IUD.
Show me sperm fertilize. Yeah, sperm finding the egg
like
to fertilize.
Similar to a jazz hand.
Jazz fingers.
It's a
jazz fingers, sperm tail.
Finger. Yeah, that's it, guys. Should I start teaching like 7th grade sex ed?
Definitely.
So basically the IUD goes into the cervix and then into the uterus, and then it just sits there, right? And there's different types of IUDs.
Let me stop you. You just talked about the process. I feel like one of the big, because I've talked to so many patients about this, one of the biggest concerns for women is they don't want anything in their body.
Yes.
So what do you say to that, about the idea of having a small little plastic T just sitting in the uterus?
Right. Well, what I validate their concern, because that is something for some women they're just not going to get over. It's a phobia.
Yeah.
It's just, I don't want something foreign in my body.
The idea of it.
Yeah, the idea of it psychologically, you're not going to change their mind on that, right? So I validate their concern, but then I explain to them that when an IUD is inserted properly, you don't feel it.
Yeah.
So it's not like you would even know it was there. You don't even know. You wouldn't even know it was there. And so that's kind of the main thing, because I think once people can wrap around like, oh, I wouldn't feel it, it wouldn't hurt, and those kind of things, then they feel maybe a little bit easier about it. And I went over the insertion because that's also a big block for people. The idea of having
that it's painful to put it in.
And I'm not going to lie, it is painful.
Yeah.
But it's fast. And I always say, like, it's a lot less painful than having a baby.
That's yeah.
Right?
Sure.
So
oh shoot, what was I just going to ask you about the IUD? Crap, I keep having these questions that are good, and then what were we talking about just a second ago? We were talking about...
I was breaking them down, and then I was just going to say that...
Yeah, go ahead, continue.
I'll just add that there's different types. There's 2 main types. There's hormonal and non-hormonal, and that's just something that a woman... Both are equally as effective, and it's important to know that all IUDs, get this, when they are in place, are actually more effective than having your tubes tied. With that said, it's completely reversible.
Isn't that insane?
That's really an
insane?
Interesting fact when you think about it.
That's so insane.
But it's reversible. And there are side effects and there's risks and all of that. So
yeah,
I'm not dismissing those things.
It isn't for everybody. But and you correct me if I'm wrong, but years ago I read that it's one of the most highly user satisfaction.
Mm-hmm. Oh yeah, it's very
like
high.
98. Yeah. Like most women, and there's a little sometimes periods change and there's kind of an adjustment period and whatever. Right. But in the end, at a year, it was like 98 or 99%. Like they're so happy with it.
Very happy with their IUD, and I can say that from patients. I can say that from friends. Most people are very happy with it.
I am a big believer and pusher in the IUD. Mm-hmm. You used this phrase before, reversible,
long-term
contraception. It's not sterilization. It's not like getting tube ties permanent, and it's user independent.
Right. You can't mess it up.
You don't have to take that pill every day.
Right.
It's there and it works regardless of whatever's going on in your life, your body. You missed one. Da 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 da. Can we talk just a second? Because I'm out of it. When I was in residency, we just started putting in Implanon.
Yeah.
Are those big? Do you like those?
Popular.
What do you think
about
those?
I like it. The newer version is Nexplanon. It's the same company. I don't know. They just changed it a little bit.
Briefly explain what that is.
So what Implanon or Nexplanon, it's what we call a subdermal implant. Dermal is your skin, so it's going right.
Just like,
we
used to put them like here.
Oh, we put them like here
now.
Yeah. So it's a very kind of skinny rod, maybe about the thickness of a grain of rice.
It's like a little plastic.
Yeah, a little plastic, little about like grain of rice, maybe about, I don't know, 3 centimeters long.
Yeah.
And it's a real easy insertion. It's easier insertion than the IUD.
Yeah.
All you do is you kind of give someone a little numbing medicine and pop it in. And I like them. I do think the biggest complaint for women is just that kind of periods might get a little bit weird. But usually people adjust to that, and most of the time people are happy.
Would you say IUD versus an implantable? So in a similar way, it is long-term reversible because you can remove it. Same way, get pregnant afterwards. And it's user independent. You don't have to take anything for it. It's not like the Depo shot where you have to come back every 3 months.
And the insertion's easier. So for women that are, that if that's the part that really freaks them out, the insertion, this is a much...
Or having something inside.
Well, this is kind of inside.
It's over here.
I agree.
It's not
I agree.
Yeah.
But really, it's an easier option, and it's again very long term. So
I think like birth control is such an important thing to talk about. Okay, so we talked a little bit about what men should know around that. What else should we talk? What else should we talk about birth control wise? Imagine so within this realm, normally you talk to women, but what would women want men to know? What would you want men to know? What should we say? Anything come to mind?
For men in terms of birth control?
Birth control.
I mean, I think kind of what we talked about of just, already of that you should be taking as a man, if you're sexually active, you should still be taking an active role in the birth control conversation.
And it means conversation.
Yeah, and even learning about them. Learn about the different types. Why should it be something that only women understand and know about? No, learn about it and learn about the side effects.
It's ridiculous how many women our age don't know what an IUD is.
Right. Oh yeah.
It's just and it's one of those things where I'm like, what? It's like, dude, you're still a doctor.
Right.
This is still what
I'm very passionate about contraception education, because if you think about it, first of all, in America, it's 50% of pregnancies are unplanned. That's a lot. That means half. And I would guess the majority of them weren't on birth control, were using birth control improperly.
Totally.
And so when you think about something like that, it's such a big deal to get pregnant, have a child, and really from a female's perspective, and you can speak to it from a male's, but like for a woman, it's not that not having a child is an amazing thing. I'm an OBGYN. It's not that I'm anti having child. Yeah. But it really can change the course of a woman's life. It's really empowering for a woman to understand her birth control options. If you get pregnant at an early age, you've just changed the course of your life.
There's not a lot of bigger things that can impact your life.
Right. Educationally, financially, relationship-wise. So like this is a big thing to kind of be aware of and have knowledge about and take ownership of responsibility if you're sexually active, be on contraception.
Well, and I think it's a different conversation with men because we don't get pregnant. We're part of that process, and it in a very real way affects our life. I mean, my daughter is 8. I love her. She's great. She's an incredible part of my life, and it's a responsibility. It has changed the trajectory of where I was going to be and what I thought I was going to do. It's worked out for me personally, but for men too.
Right.
Even though it's easier for men to kind of walk away from that, I think most of us don't, and it does impact us in one of the biggest ways.
Right.
It is a big deal. It's a huge deal.
I think that's a really great point that we are bringing home, is just for men to take responsibility in that conversation.
For sure. What else did we have? Let's pause for a second.
Okay.
Let's pause for a moment.
Okay.
How are you doing?
I'm good. I got warmer.
I'm good. Maybe I can ask you some questions about you. Do you want some more water?
Okay,
I want
sure.
a little water, not burn my face. I think it looks good. This is like, do you want the blanket? You're thinking about it. I'm thinking like 15 more minutes and we call it.
Okay. I'm good then.
Okay, so I want to ask you just a little bit about you and medicine and stuff like that.
Okay, sure.
And then one of the questions, basically, I asked you before, what's your core message? What are you passionate about? What do you really like? If there were a case or an encounter or something that you knew was going to happen when you were on, and you're like, oh, that's my favorite, what is it? What would it be?
I don't know if I have that, but I mean, I still love to deliver, but.
That's a good answer.
Okay. Thank you.
Okay. Let me just check on this and see. Okay, that guy's still rolling. At some point, I'm going to run out of battery, and it's probably about what we were saying. It's probably about 15 minutes.
Okay, perfect.
Ladies and gentlemen, welcome back to the show. I'm Dr. Larry Burchett, and I'm still joined by Dr. Pari Godsey. Dr. Pari Godsey.
Yeah.
Let me ask you some questions about you.
Okay.
How'd you get into medicine?
I have always wanted to be a doctor.
Since when?
As long as I can remember.
For real?
Yeah, I'm one of those people that say since I was 2 years old, I don't ever remember wanting to be anything else.
Yeah.
My uncle was a physician. I'm half Iranian, and he came from Iran during the revolution. He escaped.
Oh, wow.
And then he
Intense.
lived with my family and was studying to get boarded in America. And I was a little girl, and he also would help take care of us and take us to preschool and things like that. So I think he was really my main inspiration.
And you're from Houston.
I'm from Houston. Mm-hmm.
Did you think you were going to be a GYN when you were
No.
little? What did you imagine?
No. So I knew I always wanted to be a doctor. I was actually really interested in psych for a while, in high school, and then in college I was a psychology major, and I thought I wanted to maybe go into psychology. And it's funny, or psychiatry. I think it's funny because I tell people, I'm like, well, OBGYN actually still has a lot of psych stuff because, it's a lot. I think psych and psychology, it kind of spans a lot of different specialties. So I still get to do, I think, some of that stuff. But then when I entered medical school, I really wasn't totally sure. And, you kind of start doing your rotations. And what I always tell people is, as a physician, you learn, are you more manual, or do you want to do something tactile with your hands, or are you more cerebral? Do you want to be reading medical journals and discussing things? And I knew I was someone who was tactile. I wanted to get a result and that stuff. So I went more something that would involve surgery. I knew I wanted to work with women. I'm very much a girl's girl.
Where did that come from? Wanting to work with women.
It's my personality. I am close to my mother, so I don't know if that bond influences it, but I've always been a girl's girl. I've been a bridesmaid 15 times. I was in a sorority. I'm just very girl oriented. And so I just knew I wanted to work with women. And then I did my OBGYN rotation. I delivered a baby, and that was it.
Was that it?
Yes,
The delivery sealed the deal?
Yeah.
Do you remember that delivery?
I do.
Tell me about it.
I actually don't know if I did the best job because it was my first one, and I remember the upper level resident yelled at the intern, "Why did you let the med student just do it all by herself?" But I loved it, and I felt like I was like, I still, to this day, I mean, I've been in practice now 8 years plus the 4 years of residency.
Yeah.
I still get excited to deliver someone's baby. I think it's such a humbling experience because you are getting to be a part of one of, if not the most important parts of somebody's life.
Yeah.
And that's like a very touching experience for me. It's an honor.
Yeah, that's great. It's important that we're able to still derive kind of that inspiration from what we do doing this.
Yeah. So, I enjoy it.
What advice do you have for medical students or pre-meds trying to get into med school? That kind of crowd.
I think, work hard. It's if something that you feel that you really want to do, be persistent, be diligent. It's not easy, and I really do feel like you have to love it. I mean, I always tell people when I want to be a doctor, I'm like, well, you better really want to be a doctor, because I think I think it's a sacrifice. I mean, people don't see that part of it. They see Grey's Anatomy and they see people looking cute in their scrubs, and they're like, oh, it's so fun and sexy to be a doctor, and it's hard to be a doctor.
Do people see that?
Yes, people still think that stuff.
General Hospital, Grey's Anatomy.
It's cool. But it's hard to be a doctor, and not on a daily basis. Yes, on a daily basis, but also on a lifetime basis. I always say, I didn't really have my 20s in a lot of ways.
What went through my mind was you got to be ready to say goodbye to your 20s.
You sacrifice
when your friends
your 20s,
are going out every night at 5 when work is over, and
I remember when
you're not.
I went straight through, so I started practicing in private practice at 29, and I remember I went to happy hour for the first time at 29. And I was like, without it, because
welcome to life.
Welcome to life. Well, you just start, living.
But I think at 29, being not only a doctor where you have some income potential, you have a lot of loans to pay back, but you're able to impact someone's life in such a meaningful, profound, and I think in Western medicine, powerful way. Like at 29, wow. Yes, there's a big cost to it.
Yeah.
A lot of fun in your 20s, really.
But it's worth it. It's worth it.
I think it is.
I remember one time, even in residency, I remember I was like 25 or 6 at the time, and it was really late at night, and I had to stay for like it's so young. Yeah, it was really late at night, and I had to stay for like a hysterectomy, and at first, that feeling when you're in residency, you're like, oh, I just want to go home or whatever. And then I sat there and I'm like, I am 25 years old, and I am getting the opportunity to operate on someone and help their life. I don't know, I still feel like I don't know that many other careers that you can have such,
it's really cool.
A humanistic impact. You can have other impacts, of course, but a humanistic impact on someone's life. It doesn't matter that I don't get to sleep that much tonight, or that I can't go to this party or whatnot.
Yeah. It's very meaningful. Worth it.
Yes, worth it.
So you've been out of residency for 8 years now.
So
you did private practice for 5 years in Texas, and now you've kind of switched gears and you're doing something a little different out here. Tell me about that.
So what I do now is I'm what's called an OBGYN hospitalist. And
what does that mean?
I work for a hospital. Okay. So it's modeled after, kind of like an ER doctor, where you're in-house, you're seeing patients that are coming in off the street. You don't have any of your private patients.
So you don't have a practice anymore.
I don't have
you
a practice.
just work in the hospital, whatever comes through that they need you to do.
And I do shifts essentially. So I do 9 24-hour shifts every 28 days.
How do you like that? Very different from the private practice world, right?
Very different from private practice. I love it because it is a very good work-life balance for me. It allows me to kind of see okay, I can have more of a life, and I do enjoy doing things like we're doing today, right?
She worked yesterday, actually. It's not even 12 hours ago you were on working.
But a lot of times when you're in private practice, you don't get to do any sort of other outside interests, and my interests do still surround women's health. I work with a charity, I work with Power to Decide, I do media stuff, I contribute, I educate, and I would not have that type of time if I was in a full-time private practice.
So it sounds like for OBGYN, for what you were doing, kind of private practice, it's just much busier.
Yes, it's very busy. You're doing office, and then you're also operating, and then you take call, but then you also have your patients, which I think a lot of times in other specialties it's easier for, and I don't know, maybe I shouldn't be saying that because I can't speak.
No, I think it is with OB deliveries especially.
Because other specialties, if you're not on call, you're not on call. You didn't get the phone call or whatever. But for us, you're with these people for 40 weeks. It's the most important time in their life, and they want you to deliver their baby. And so even when you're not, and I wanted to deliver their baby. I mean, you want to be there for them. So, you know, I think with that, you end up going in the middle of the night. I mean, I did. I was going in the middle of the night. I was going on the weekends to deliver my patients even when I'm not on call. So it becomes very, very time consuming. So.
Well, I mean, one of the words that comes to my mind is burnout. Like, it's really easy to burn out with that just like continual responsibility, the private practice, and it's intense.
Well, and again, it's burnout, and it's also work-life balance in terms of, I think it's, you know, a lot of times people in medicine have a hard time cultivating relationships, intimate relationships, marriages, children, all that stuff. So it's something to kind of look
intimacy.
At. Yes, you have to
circling back around.
You have to have time to put in and.
Okay, let me ask you, Dr. Dr. Pari, some questions about your health. Can I do that?
Yeah, sure.
How is your health these days?
I think my health is good. I think it is better than it was when I was in medical school, residency.
How so better?
I think that's another thing with this new job and having the work-life balance. I have much more time to exercise. I have, even though I work weird shifts, my sleep is probably better, you know, overall.
Than the random delivery that you had before,
So, and I think, you know, those are obviously very important things.
Yeah. What are two things you do, habits, that you would say are like most beneficial for your health?
I think I try to be active every day, even if it's not a full workout. Even if I've worked like the night before, even when I'm at the hospital, I try to take time out to even like just walk, you know.
What kind of stuff do you like to do to be active?
I typically do, you know, like I walk, I do spin classes, I'll, you know, do Pilates.
Do you do spin?
Yeah, I love spin. Yeah. And it's like a newer thing for me, like probably in like the past like year or so.
Yeah.
But it's very...
Spin's crazy.
Yeah, it's very...
It's fun. I think everybody should try it.
Yeah.
Just because those people are nuts.
It's very...
But it's great.
It's very invigorating. Now, I will tell you, I took one spin class that I hated. I'm going to tell you about it.
Okay.
Because it was... And I guess there's a few like this, and it was at my gym, and it was called like Pursuit Burn.
Okay.
But basically, they put your name up, and you're like publicly competing with everyone, and that's not my deal. Like, I like to be competing
like
with
Orange
myself.
Theory Fitness, where everybody sees.
But this one, they were calling you out. They'd be like, Pari. I'm like, no, I don't want to. Climb that hill. Get your butt off that bike. It's like, you're in third place. Hurry. I'm like, what? I don't know. For me, I like to like compete with myself. I don't necessarily need to be competing with like random people. That's me though. Some people would thrive after it.
I would probably love it and want to go back for more, whether that's a good thing or not.
Just depends on your
okay, let me ask you this. What are your, for you, like right now, what are your challenges for your health? Do you have any?
Yeah, I think sleep's still always a little bit of one because I'm doing, you know, the shift work, and that's that's hard. And I think sleep, and I would say
it's like I said, every doctor ever, especially if you do night shifts.
I think maybe time to myself, whether that be like I'm not someone who's yet been able to master meditation, or, you know, I relax, but in a very non-relaxing way where I'm like chilling out on Instagram. That's not relaxing.
Yeah.
So I think, you know, I do think it's crucial, especially in a digital world, to unplug and take time for yourself and reflect. It's so
funny you say that. I'm going to plug this.
Okay.
This is my March 5th video that is going to be on Instagram,
Okay.
my little YouTube thing, is I turned my phone off for 24 hours.
See, I want to start doing that.
I'm gonna send you my little blog.
Okay, perfect.
Read it.
Yes.
I totally freaked out, but it was amazing.
I would freak out. I told two girlfriends.
So good, you should do it.
I'll do it. I told my two girlfriends this week that I was like, I feel like I'm getting addicted to my phone, and I feel like even though I'm sometimes doing stuff that's productive, overall, it's not helping my productivity.
So this is what happened when I did it. First of all, I was all anxious. Oh my God, some emergency's gonna happen.
Right.
Somebody won't be able to call me. Turned off the phone, and I just walked from here to IHOP, and I started noticing things I'd never noticed before. And I got a little bit like anxious, needy, which made me more social. So I'm like just kind of being nicer to the hostess and the people around.
Well, because you're not looking down at something.
Not only
too.
that, but because I didn't have a way to communicate with anybody else for the rest of the day. So like my social needs had to get met in my immediate environment.
Yes.
I really liked it.
And I think this is, I do think this ties into health, because even the social aspect of it, I think people need human to human talking. It's not the same that if you've been on texting somebody all day, or you've been on Facebook all day, or whatever. That's not the same. Connecting. That's not the same as human touch and looking at someone and interacting. And I think we know humans are social creatures, and the more social you are, the more real relationships you cultivate, the better health you have, the longer you live.
Totally. Do you have a message? Do you have like a core message?
I think, if I have a core message, it's knowledge is power. And when it comes to your body, know as much as you can know about it. Learn about your anatomy, learn about yourself, and have a two-way conversation with, your healthcare providers.
Great. Should we wrap it up?
Sure.
Anything else? Are there, if people are watching this, is there a way they can contact you or a website?
Yeah, sure. So I have a website. It's drpari.com. It's DOCTORPARI.com. And you can find me on Instagram as well, Dr. Pari, and they can always message me there.
Thank you very much
Thank you for
doing
having
this.
me.
This was a lot of fun. I hope
Thank
you guys enjoyed this. Check out the YouTube channel. Please check out her stuff. And we will see you next time.
Yeah. Thanks.
Oh, this was good.
This was good.
I'm so excited to... Look at that. 3 minutes left.